datang di Departemen Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala dan Leher Fakultas Kedokteran Universitas Airlangga, RSUD Dr. Sutomo, Surabaya. Di sini kami menyelenggarakan pendidikan, penelitian, serta pengabdian masyarakat yang profesional dan berbasis kepada pengembangan ilmu pengetahuan dan teknologi kedokteran yang bertaraf internasional berdasarkan etika dan moral agama pada tahun 2020.
Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala dan Leher Fakultas Kedokteran Universitas Airlangga, Rumah Sakit Umum Daerah Dr. Sutomo, Surabaya, dibentuk dengan tujuan untuk mendukung visi dan misi Universitas Airlangga, yaitu menjadi universitas yang mandiri, inovatif, terkemuka di tingkat nasional dan internasional, pelopor pengembangan ilmu pengetahuan, teknologi, dan humaniora, berdasarkan moral agama melalui upaya tridharma perguruan tinggi, pendidikan, penelitian, dan pengabdian masyarakat di bidang ilmu kesehatan THTKL. Sebagai koordinator program studi, tujuan kami adalah menghasilkan lulusan tenaga medis profesional di bidang THTKL yang unggul di bidang klinis dan ilmiah, serta berwawasan luas dan memiliki keterampilan serta sikap profesionalisme, bertanggung jawab dalam pengamalan ilmu kesehatan yang berlandaskan etika dan moral agama.
datang di Departemen Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala, dan Leher Fakultas Kedokteran Universitas Airlangga, RSUD Dr. Sutomo, Surabaya. Di sini kami menyelenggarakan pendidikan, penelitian, serta pengabdian masyarakat yang profesional dan berbasis kepada pengembangan ilmu pengetahuan dan teknologi kedokteran yang bertaraf internasional berdasarkan etika dan moral agama pada tahun 2020.
Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala, dan Leher Fakultas Kedokteran Universitas Airlangga, Rumah Sakit Umum Daerah Dr. Sutomo, Surabaya, dibentuk dengan tujuan untuk mendukung visi dan misi Universitas Airlangga, yaitu menjadi universitas yang mandiri, inovatif, terkemuka di tingkat nasional dan internasional, pelopor pengembangan ilmu pengetahuan, teknologi, dan humaniora, berdasarkan moral agama melalui upaya tridharma perguruan tinggi, pendidikan, penelitian, dan pengabdian masyarakat di bidang ilmu kesehatan THTKL. Sebagai koordinator program studi, tujuan kami adalah menghasilkan lulusan tenaga medis profesional di bidang THTKL yang unggul di bidang klinis dan ilmiah, serta berwawasan luas dan memiliki keterampilan serta sikap profesionalisme, bertanggung jawab dalam pengamalan ilmu kesehatan yang berlandaskan etika dan moral agama.
pendidikan empati, pusat pendidikan terkemuka, world class medicine faculty. Fakultas Kedokteran Unair tercinta, jiwa wirausaha, akhlak mulia, profesional, responsif, inovatif, modern dan bangun entrepreneurship. Mencintai kita Unair, hati kan empati, tanggung jawab disiplinkan diri, the prime medicine faculty. Kita Unair, kita mencintai, kita Unair, hati kan empati, tanggung jawab disiplinkan diri, the prime medicine faculty, the prime medicine faculty.
Selamat datang di Departemen Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala dan Leher, Fakultas Kedokteran Universitas Airlangga, RSUD Dr. Sutomo, Surabaya. Di sini kami menyelenggarakan pendidikan, penelitian, serta pengabdian masyarakat yang profesional dan berbasis kepada pengembangan ilmu pengetahuan dan teknologi kedokteran yang bertaraf internasional, berdasarkan etika dan moral agama pada tahun 2020.
Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala dan Leher Fakultas Kedokteran Universitas Airlangga, Rumah Sakit Umum Daerah Dr. Sutomo, Surabaya, dibentuk dengan tujuan untuk mendukung visi dan misi Universitas Airlangga, yaitu menjadi universitas yang mandiri, inovatif, terkemuka di tingkat nasional dan internasional, pelopor pengembangan ilmu pengetahuan, teknologi, dan humaniora, berdasarkan moral agama melalui upaya tridharma perguruan tinggi, pendidikan, penelitian, dan pengabdian masyarakat di bidang ilmu kesehatan THTKL. Sebagai koordinator program studi, tujuan kami adalah menghasilkan lulusan tenaga medis profesional di bidang THTKL yang unggul di bidang klinis dan ilmiah, serta berwawasan luas dan memiliki keterampilan serta sikap profesionalisme, bertanggung jawab dalam pengamalan ilmu kesehatan yang berlandaskan etika dan moral agama.
Kedokteran Unair tercinta, jiwa wirausaha, akhlak mulia, profesional, responsif, inovatif, modern dan bangun entrepreneur. Kita mencintai, kita Unair, hati kan empati, tanggung jawab, disiplinkan diri, the prime medicine faculty. Kita Unair, kita mencintai, kita Unair, hati kan empati, tanggung jawab, disiplinkan diri, the prime medicine faculty, the prime medicine faculty.
Selamat datang di Departemen Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala dan Leher, Fakultas Kedokteran Universitas Airlangga, RSUD Dr. Sutomo, Surabaya. Di sini kami menyelenggarakan pendidikan, penelitian, serta pengabdian masyarakat yang profesional dan berbasis kepada pengembangan ilmu pengetahuan dan teknologi kedokteran yang bertaraf internasional, berdasarkan etika dan moral agama pada tahun 2020.
Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala dan Leher Fakultas Kedokteran Universitas Airlangga, Rumah Sakit Umum Daerah Dr. Sutomo, Surabaya, dibentuk dengan tujuan untuk mendukung visi dan misi Universitas Airlangga, yaitu menjadi universitas yang mandiri, inovatif, terkemuka di tingkat nasional dan internasional, pelopor pengembangan ilmu pengetahuan, teknologi, dan humaniora, berdasarkan moral agama melalui upaya tridharma perguruan tinggi, pendidikan, penelitian, dan pengabdian masyarakat di bidang ilmu kesehatan THTKL. Sebagai koordinator program studi, tujuan kami adalah menghasilkan lulusan tenaga medis profesional di bidang THTKL yang unggul di bidang klinis dan ilmiah, serta berwawasan luas dan memiliki keterampilan serta sikap profesionalisme, bertanggung jawab dalam pengamalan ilmu kesehatan yang berlandaskan etika dan moral agama.
Pagi, Dokter Asra. Ya, oke.
Pagi, Assalamualaikum.
Dok, konsepnya
Iya,
mau
iya.
seperti ini atau nanti slide-nya jalan sendiri jenengan?
Oh ya, kalau
Kalau-
gitu seperti ini aja enggak apa-apa lah.
Kalau
Tapi
seperti
gini
ini
loh.
nanti saya bantu dari sini.
Iya, soalnya saya takutnya itu loh. Nanti saya bikin anu aja ya, apa namanya? Slide gitu aja ya. Ya.
Oke,
Ganti
gitu
slide
aja.
ya.
Slide kita tahu
Iya.
next, monggo terserah.
Next, oh ya next saja enggak apa-apa.
Oke.
Supaya lancar saya nyanyi, supaya lancar aja. Next saja nanti ya.
Oke, next aja boleh, oke.
Next, oke next. Ya, oke next.
Oke,
Oke.
terima kasih dokter.
Ya ya, next ya. Ya. Oke.
Fakultas Kedokteran, Unai tercinta, jadi kebanggaan Indonesia. Pelopor pengembangan pengetahuan, inovasi, adaptif kolaborasi.
Kita mencintai Irka Unair, hati kan empati, pusat pendidikan terkemuka, world class medicine faculty. Fakultas Kedokteran, Unair tercinta, jiwa wirausaha, akhlak mulia, profesional, responsif, inovatif, modern dan bangun entrepreneurship. Kita mencintai Irka Unair, hati kan empati, tanggung jawab, disiplinkan diri, the prime medicine faculty. Irka Unair, kita mencintai Irka Unair, hati kan empati, tanggung jawab, disiplinkan diri, the prime medicine faculty. The prime medicine faculty.
Selamat datang di Departemen Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala, dan Leher Fakultas Kedokteran Universitas Airlangga, RSUD Dr. Sutomo, Surabaya. Di sini kami menyelenggarakan pendidikan, penelitian, serta pengabdian masyarakat yang profesional dan berbasis kepada pengembangan ilmu pengetahuan dan teknologi kedokteran yang bertaraf internasional berdasarkan etika dan moral agama pada tahun 2020.
Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala, dan Leher Fakultas Kedokteran Universitas Airlangga, Rumah Sakit Umum Daerah Dr. Sutomo, Surabaya, dibentuk dengan tujuan untuk mendukung visi dan misi Universitas Airlangga, yaitu menjadi universitas yang mandiri, inovatif, terkemuka di tingkat nasional dan internasional, pelopor pengembangan ilmu pengetahuan, teknologi, dan humaniora, berdasarkan moral agama melalui upaya tridharma perguruan tinggi, pendidikan, penelitian, dan pengabdian masyarakat di bidang ilmu kesehatan THTKL. Sebagai koordinator program studi, tujuan kami adalah menghasilkan lulusan tenaga medis profesional di bidang THTKL yang unggul di bidang klinis dan ilmiah, serta berwawasan luas dan memiliki keterampilan serta sikap profesionalisme, bertanggung jawab dalam pengamalan ilmu kesehatan yang berlandaskan etika dan moral agama.
medicine faculty. Kita unai, kita mencintai. Kita unai hati kan empati, tanggung jawab disiplinkan diri. The Prime Medicine Faculty. The Prime Medicine Faculty.
Selamat datang di Departemen Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala, dan Leher Fakultas Kedokteran Universitas Airlangga, RSUD Dr. Sutomo, Surabaya. Di sini kami menyelenggarakan pendidikan, penelitian, serta pengabdian masyarakat yang profesional dan berbasis kepada pengembangan ilmu pengetahuan dan teknologi kedokteran yang bertaraf internasional, berdasarkan etika dan moral agama pada tahun 2020.
Program Studi Ilmu Kesehatan Telinga, Hidung, Tenggorok, Bedah, Kepala, dan Leher Fakultas Kedokteran Universitas Airlangga, Rumah Sakit Umum Daerah Dr. Sutomo, Surabaya, dibentuk dengan tujuan untuk mendukung visi dan misi Universitas Airlangga, yaitu menjadi universitas yang mandiri, inovatif, terkemuka di tingkat nasional dan internasional, pelopor pengembangan ilmu pengetahuan, teknologi, dan humaniora, berdasarkan moral agama melalui upaya tridharma perguruan tinggi, pendidikan, penelitian, dan pengabdian masyarakat di bidang ilmu kesehatan THTKL. Sebagai koordinator program studi, tujuan kami adalah menghasilkan lulusan tenaga medis profesional di bidang THTKL yang unggul di bidang klinis dan ilmiah, serta berwawasan luas dan memiliki keterampilan serta sikap profesionalisme, bertanggung jawab dalam pengamalan ilmu kesehatan yang berlandaskan etika dan moral agama.
Assalamualaikum warahmatullahi wabarakatuh and a very good morning. I would like to welcome Dr. Muhammad Miftahul Surur, MCAS PhD Internist Consultant as the Vice Rector of Universitas Airlangga, representing the Rector of Universitas Airlangga, Professor Dr. Budi Santoso, Obstetric and Gynecologist Consultant as the Dean of Medical Faculty, Universitas Airlangga, Dr. Doni Wahyu Hadi, Neurosurgery Specialist Consultant, Director of Dr. Sutomo General Academic Hospital, Professor Dr. Nasronuddin, Internist Consultant, Pinasim, Director of Airlangga University Hospital, Dr. Asra Al-Fauzi, SAMM, Neurosurgery Specialist Consultant, FICS, IFAANS, as the Chairman of International Office Faculty of Medicine, Universitas Airlangga, Dr. Muhtarum Yusuf, Otorhinolaryngology Head and Neck Surgery Specialist Consultant, FICS, the Head of Otorhinolaryngology Head and Neck Surgery Department, Dr. Dwi Reno Pawarti, Otorhinolaryngology Head and Neck Surgery Specialist Consultant, FICS, the Head of Medical Staff Group, Otorhinolaryngology Head and Neck Surgery Department, Dr. Artono, Otorhinolaryngology Head and Neck Surgery Specialist Consultant, FICS, as the coordinator of Otorhinolaryngology Head and Neck Surgery Study Program, esteemed professors of Otorhinolaryngology Head and Neck Surgery Department, honorable professors, head of departments, head of medical staff group, coordinators of study program Faculty of Medicine, Universitas Airlangga, senior staff members, and dearest residents, Dr. Eka Sumianti, wife of Professor Baharudin, Dr. Suharyoto Sudiro, Otorhinolaryngology Head and Neck Surgery Specialist, and Mrs. Roswati, parents of Professor Baharudin, Dr. Tri Hedianto, Otorhinolaryngology Head and Neck Surgery Specialist and wife, Mr. Dwi Pramono, and Mrs. Ati Prastowo. Last but not least, the Honorable Professor Dr. Baharudin Abdullah, as the Adjunct Professor of Otorhinolaryngology Head and Neck Surgery Department, Medical Faculty, Universitas Airlangga, Dr. Sutomo General Academic Hospital, Surabaya, and to all our distinguished guests. Today, on November 30th, 2021, the Otorhinolaryngology Head and Neck Surgery Department is proud to present the Adjunct Professor Inauguration Ceremony. On this special occasion, the Otorhinolaryngology Head and Neck Surgery Department has invited Professor Dr. Baharudin Abdullah from the Department of Otorhinolaryngology Head and Neck Surgery, University Science Malaysia. Before we start our inauguration ceremony, allow me to share the rundown of today's events. After this opening, we will continue with the National Anthem Indonesia Raya, followed by Hymne Airlangga, curriculum vitae reading, opening speech by the head of Otorhinolaryngology Head and Neck Surgery Department, welcome speech by the Dean of Medical Faculty of Universitas Airlangga, scientific oration by Professor Dr. Baharudin Abdullah, ceremonial formal speech by the Rector, represented by Vice Rector of Universitas Airlangga, the inauguration ceremony, and closing. Thank you for your attention. We shall start our inauguration ceremony. First of all, let us give praise to Allah Subhanahu wa Ta'ala. Because of His blessings, we can all participate in today's event. We will now listen to the National Anthem Indonesia Raya, followed by Hymne Airlangga. I invite all guests to put their right hand on the left chest while we listen to the National Anthem. Thank you.
Indonesia kebangsaan
We continue with curriculum vitae reading by Dr. Asra Al-Fauzi, SAMM, Neurosurgery Specialist Consultant, FICS, IFAANS. Dr. Asra, the time is yours.
Okay, thank you, Dr. Iqbal, for a great opening. Assalamualaikum warahmatullahi wabarakatuh. Dear Honorable Vice Rector, Dr. Miftah Surur, dear Honorable the Dean of Medical Faculty, Professor Budi Santoso, dear Dr. Muhtar Yusuf, as a Chairman of the Department, dear Professor, Vice Deans, and distinguished guests, ladies and gentlemen, and of course, again, dear Honorable Professor Dr. Baharudin Abdullah. I will start this wonderful forum by reading out a short CV of Professor Baharudin. Professor Dr. Baharudin Abdullah is currently a senior professor at the Department of Otorhinolaryngology, Head and Neck Surgery, School of Medical Sciences at reputed Universitas of Malaysia, Kubang, Kerian, Kelantan, Malaysia. Next slide. Professor Baharudin has graduated his MBBS with honors and distinction from University Malaya, and he completed his Master of Medicine from University Saint Malaysia, and then became an honorary visiting scholar at the Chinese University of Hong Kong since 2006. In the same year, Professor Baharudin is also undergoing an Asian Surgical Association Clinical Fellow at the University of Hong Kong, and before finally also becoming a fellow in rhinology and ESS in 2014 from the University of Graz, Austria. Next slide. Okay. With his various contributions and dedication so far, Professor Baharudin has held many important positions in various organizations. As shown in the slide, since 2002, he has been a senior lecturer as well as senior consultant at University Science Malaysia. From 2002 to 2003, he served as Honorary Secretary, Malaysian Society of ORL HNS. And in 2019 to date, he has been named President of the Malaysian Society of Allergy Immunology. Professor Baharudin, over his academic journey since 2002, has been invited also as an editorial board member of Medical Journal of Malaysia, BMC Research Notes, Sinusitis, and guest editor of Pediatric Investigation. He was also appointed to be a reviewer board member of 78 prestigious journals. Slide. And you can see from this slide, his contribution to science, especially the world of medicine, cannot be doubted. He has published 2 books, 4 book chapters, and more than, I think, 212 journal articles. Some of them we can see on the slide. Next. You can see here many his contribution to the many articles in the journal. Slide. You can see here his contribution to science. Next slide. Currently, Professor Baharudin is also part of 2 prestigious research projects. The first is understanding Epstein-Barr virus LMP1 mutation effect on immunopathogenesis of nasopharyngeal carcinoma patient since 2018. And last year started a research project entitled Elucidating the Involvement of Periostin in the Regulation of Inflammatory Marker and Immune Cell Phenotypes in Chronic Rhinosinusitis with Nasal Polyps. Indeed, Due to the limited time, it is impossible for us to discuss all the achievements that have been obtained by Professor Baharudin all this time. But at least with this few slides, we have got to know him. We also know how much dedication he has for the work of medicine, especially otorhinolaryngology, which has been able to bring us to this point. Thank you again for your attention. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Asra. Next, I would like to invite Dr. Muhtarum Yusuf, Otorhinolaryngology Head and Neck Surgery Specialist Consultant, FICS, as our Head of Otorhinolaryngology Head and Neck Surgery Department to deliver his opening speech.
Thank you, Master Ceremony. Assalamualaikum warahmatullahi wabarakatuh. Good morning, the Honorable Rector, to whom represented by Vice Rector of Universitas Airlangga for Internalization, Digitalization, Information, Dr. Muhammad Miftahul Surur, MPhil PhD, Internist Consultant. The Honorable Dean of Medical Faculty Universitas Airlangga, Professor Dr. Budi Santoso, Gynecologist Consultant. The Honorable Director of Dr. Sutomo Hospital, Surabaya, Dr. Johnny Wahyuadi, Neurosurgery Specialist Consultant, and the Honorable Director of Airlangga University Hospital, Professor Dr. Nasruddin, Internist Consultant. The Honorable Professor of Otolaryngology Head and Neck Surgery Department, the Honorable Coordinator of Otolaryngology Head and Neck Surgery Department Study Program, staff senior, members, and dear residents. It gives me a great pleasure to welcome all of you to this inauguration ceremony of our adjunct professor, organized by OLNS Department, Faculty of Medicine, Universitas Airlangga, Dr. Sutomo General Hospital. Welcome to our special guest, Professor Dr. Baharudin bin Abdullah. Thank you for joining us today. Otolaryngology Head and Neck Surgery Department, as a part of Universitas Airlangga, is determined to establish Tri Dharma University, consists of education and teaching, research and development, and community service. In implementing the second point, research and development, we had our program to invite young professors from well-known universities around the world to share at least in escalating our competency in conducting and publishing more research. At the time, it is Professor Dr. Baharudin bin Abdullah from Department Otolaryngology, University Sains Malaysia. We believe this program will improve the quality of our doctors, improve the rank of submitted journals, improve the grade of our medicine faculty, and provides a good opportunity for Universitas Airlangga to develop international collaboration and step in the right direction to become a world-class university with the motto "Excellent with Morality." Once again, we would like to thank you, Professor Dr. Baharudin bin Abdullah, and we are delighted to have you for the program. I would like to thank the committee chairman, committee members, and all who have supported this event. We hope this event will run smoothly and inspire us all. That's all from me. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi. Thank you very much, Dr. Muhtarum. Next is the welcoming speech by the Dean of Medical Faculty, Universitas Airlangga, to Professor Dr. Budi Santoso, Obstetric and Gynecologist Consultant. The time is yours.
Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. The Honorable Vice Rector Dr. Muhammad Miftah Surur, Medical Doctor, PhD, and today's guest of honor, Professor Dr. Baharudin Abdullah from School of Medicinal Sciences, Universitas, Science, Malaysia. The Honorable the Head of Sutomo General Hospital Surabaya, the Honorable the Head of the Universitas Airlangga Hospital, the Honorable of Otorhinolaryngology Head and the Neck Surgery Department, Fakultas of Medicine, Universitas Airlangga, the Professor, Senior, and staff of Otolaryngology Head and Neck Surgery Department, Fakultas of Medicine, Universitas Airlangga, and all of our distinguished guests. On behalf of the Faculty of Medicine, Universitas Airlangga, I would like to welcome all of you and express my sincere gratitude to Professor Dr. Baharudin Abdullah as Adjunct Professor in Otorhinolaryngology Head and Neck Surgery Department, Faculty of Medicine, Universitas Airlangga. As we know, Professor Dr. Baharudin Abdullah is professor with a background in allergic, immunology, and rhinology. He held various international and national positions, such as being a member of the ARIA, Allergic Rhinitis and its Impact on Asthma Working Group, a Malaysian representative for the Asian Society of Head and Neck Oncology, and as a teaching member of APOS, Asia Pacific Otorhinolaryngologic Surgical Training Group. Professor Baharudin has published and presented more than 200 publications and active served in the international professional community as both speaker and presenter, as well as attending more than 350 symposiums and workshops around the world. He has hosted more than 40 conferences with various positions and responsibilities, ranging from organization committee to being chairperson. Given his expertise in the field of rhinology, especially in functional endoscopy, sinus surgery, FAST, and also his profound knowledge in allergic immunology, we expect to be able to learn a vast amount of knowledge from Professor Baharudin. Once again, on behalf of the university, it is my great honor to say that we are really honored to have Professor Baharudin Abdullah as our honorary professor in the Faculty of Medicine, Universitas Airlangga. I also would like to express my sincere thankfulness to Professor Bahar, and we do hope that it can be a long-term and mutual beneficial partnership. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Professor Budi Santoso. Now, it is with great honor that we welcome Professor Dr. Baharudin Abdullah to start his oration titled, The Rhinologist, Significance and Relevance in a Changing World.
Assalamualaikum, good day, friends, colleagues, ladies and gentlemen. It gives me great honor to serve as the visiting professor for the Faculty of Medicine, Universitas Airlangga, Surabaya, Indonesia, specifically for the Department of Otorhinolaryngology, Head and Neck Surgery. I would like to thank Dr. Budi Sutikno and his wonderful team for the kind arrangement and coordination. And I would also like to thank members of the Faculty of Medicine, Universitas Airlangga, for the appointment. For today, I would like to talk about the significance and relevance of the rhinologist in a changing world. This is where I'm from, the town of Kota Bharu, which is located at northeast of Malaysia. Some would describe Kota Bharu as a quaint coastal town bordering with southern Thailand. I work at the hospital in Resmi, Malaysia, an 800 beds hospital with multidisciplinary specialties And the school where I belongs to, or the faculty where I work, is the School of Medical Sciences, Institute of Science Malaysia, which is just besides the hospital. So, how best can we describe who is a rhinologist? Many people probably would think that a rhinologist is a specialist that treats patient that has allergic rhinitis, those patients that has nasal symptom when exposed to allergens, and also patient that has chronic rhinosinusitis with or without nasal polyp, those patients that tend to has inflammation of the nose and sinuses. And indeed, these are the two most common conditions being treated by a rhinologist. But a rhinologist don't only treat this condition, but goes further to treat other conditions as well. Besides inflammation, a rhinologist also has to treat myriad of conditions. For example, patient that has bacterial infection of the frontal sinuses, especially young patient that has facial injuries, facial fractures, patient that has sinonasal tumors. It can be benign tumors, and also it can be malignant tumors. And these tumors can also extend to the critical structures surrounding the sinonasal area, such as the orbit, as well as the skull base. Now let's look at the two most common conditions being treated by a rhinologist. On your left-hand side is the image of a nasoendoscopic examination of a patient with allergic rhinitis. On your right-hand side is the image of a nasoendoscopic image of a patient with chronic rhinosinusitis with nasal polyps. To those uninitiated eyes, probably it's a bit hard to differentiate between this condition from these nasoendoscopic images. But to the rhinologist, they will look for the telltale signs of a thick purulent discharge, which indicates that the patient probably is having chronic rhinosinusitis. If it's a clear discharge, most probably the patient is having just an allergic rhinitis. The presence of polyps is obvious, that indicate and suggest the patient is having an chronic rhinosinusitis. Probably if just patient having just the mucosal edema and also some redness of the mucosa, probably the patient is just having an allergic rhinitis. And this just highlights that those patients that has nasal symptom has to be referred to the rhinologist for them to perform a nasoendoscopic examination that can diagnose certain condition and exclude other condition. This study probably highlights better what a nasoendoscopic examination can do. As you can see on the videos on the upper part of the slide, showing a white light endoscopy as compared to a spice endoscopy, which can confirm that this patient is having a tumor instead of just a nasal polyps, by differentiating the vascular patterns of the mass. And in fact, this is what endoscopy can contribute to our diagnostic profiling and diagnostic tool to diagnose our patient properly and avoid late diagnosis, so that the patient can be treated effectively immediately. And this is one of the studies where we confirm that by using knee endoscopic calcification, which is associated with the use of NBI, which can also be used and adopted for the spice endoscopic system, which is being widely used in most centers by the rhinologists. When a rhinologist treats patient having allergic rhinitis, this is the first line of management, using pharmacological treatment of intranasal corticosteroid and also oral antihistamine, depending on the severity of the condition. Apart from those medication, Other pharmacological treatment of allergic rhinitis also includes montelukast. Montelukast is used quite widely in patients with bronchial asthma, and it has been shown that montelukast is very effective in relieving the nighttime symptoms of allergic rhinitis. In addition to the pharmacological treatment, the non-pharmacological treatment that has been shown to be effective is like nasal irrigation. How does nasal irrigation works? There are three mechanisms. The first mechanism of nasal irrigation is by promoting the ciliary beating frequency. This facilitates the clearance of the mucus from the nose, and also nasal irrigation soften the thick secretion. When the thick secretion is becoming more softer, it facilitates the clearance of the mucus, and patient definitely can breathe better. In addition to that, the third mechanism is the removal of the inflammatory mediators. And when there is less inflammation around that localized area, this definitely also reduces the symptoms of allergic rhinitis. Nowadays, with the era of the precision medicine, all the treatment now focuses on specific inflammatory mediators. And in this review that I performed with together with my good friend Dr. Budi Sutikno, we reviewed all those available biologics, and it has been shown that this biologics works well in adults as well as children that suffers from allergic rhinitis and also chronic rhinosinusitis. One of those biologic is an anti-IgE, which is omalizumab. Omalizumab is available widely worldwide, but the issue with biologic is that all those new treatment always come at a cost, and it is quite expensive for any patient to use it, and also is not being covered by most of the government hospital. Besides the pharmacological treatment, patient can also opt for preventive measures, avoid the contact and exposure to allergens. The use of complementary and alternative therapies is quite popular in our part of the world, and the use of the consumption of snakehead fish and also intranasal honey sprays have been used in clinical trials to determine its efficacy, but at the moment its use is only as an adjunct to the available pharmacological treatment. The wide variety of available options in treating patients with allergic rhinitis creates confusion, especially at the primary care level. In this where the rhinologist can play a very critical and crucial role in working with their other colleagues in setting up a standardized guidelines, consensus, and recommendations, because we have seen that there is this knowledge gap among the primary care practitioners, and this is where the rhinologist can play an effective role in getting the primary care practitioners to understand better in how they can and we can optimize the management of allergic rhinitis. Failure of pharmacological treatment may require for the patient to undergo surgery. In this patient with allergic rhinitis, we can see how the inflammation has created or causes the patient to have blocked nose due to the engorgement and also swelling of the inferior turbinates, which blocks the nasal airway. And in this patient, when the patient don't respond to the pharmacological treatment, we need to relieve the inferior turbinate hypertrophy. There are many ways for a rhinologist to perform the turbinate reduction. One of the preferred procedure for a rhinologist to do this is by doing a turbinoplasty. There are several options in performing a turbinoplasty, which is a procedure to remove parts of the turbinate structures, such as the lateral part of the nasal mucosa, the lateral part of the turbinate mucosa, together with the soft erectile tissues and also the turbinate bone, in order to create space inside of the both of the nasal cavities. And the rhinologist can opt for the use of micro instruments, the power instruments such as microdebrider. And in this study, we have demonstrated the first time the use of coblation, which facilitates the procedure of a turbinoplasty by offering or provides cutting for the removal of the turbinate structures, together with the options of coagulating or stopping the bleeding at the same time. Rhinologists also has to perform more advanced procedures, and topmost in their mind when they are performing such procedures is how best for them to avoid complications. Experts have admitted that at times they were also lost during surgery. Whenever surgeons lost their way during surgery, they will abandon those procedures, because that is when they will encounter complication. Nowadays, there are now rising number of medical legal cases, and surgeons must have a good strategy and planning to avoid from having such cases whenever they perform surgery. Whenever a rhinologist perform an endoscopic sinus surgery, the use of an anatomical landmark is useful to avoid complication, and one of them is an orbital floor. Orbital floor has been stated by experts such as Professor Richard Harvey. When we stay below or at the level of the orbital floor, when the section proceeds posteriorly, and we will avoid coming into contact or breaching the skull base. In diagrammatic format, this is how it looks. You can see the orbital structures, which is in a circle, and when we perform the endoscopic sinus surgery, we should stay below the orbital floor in order for us not to go upwards into the orbits, as well as not to breach the skull base and creating unnecessary complication. And from our review, we have shown that the orbital floor is a reliable and very useful anatomical landmark whenever rhinologists perform an endoscopic sinus surgery, and also for us to avoid an unnecessary complication. However, there are other circumstances that we must use other technologies, such as navigation, whenever we perform rhinologic surgery. An image-guided navigation works like a GPS, and it provides real-time images for us to do a precise resection of diseased tissues or structures, and also to avoid going into the critical areas. However, it is also not a substitute for anatomy. It's just to provide an additional reassurance for surgeon to perform precise resection or precise dissection. From our review, the use of image-guided navigation system is useful in the following scenarios. Whenever surgeon perform revision endoscopic sinus surgery, when the surgeon expect to encounter distortion of the sinus anatomy, cases of extensive polyposis, when there are pathologies involving the sinus structures such as frontal sinus, posterior ammoid, and sphenoid sinus, which are the which form the hard to reach sinonasal anatomy. When there are disease at around the skull base, orbit, or the optic nerve or the carotid artery, when the surgeons dealing with cases of CSF rhinorrhea, or when there are skull base defects, and when surgeons are managing patient or doing surgery in patient with benign and also malignant tumors. Use of technology by a rhinologist can be demonstrated in the following case. For a rhinologist to surgically manage an orbital abscess even in an adult is very challenging. What more if it is in an infant? We can see in this infant there is a formation of an abscess in the right medial part of the orbital cavity, and this abscess has extended posteriorly to form a retroorbital abscess. If we don't treat the abscess appropriately or adequately, this abscess may spread and cause intracranial abscess and even worse, septicemia. And in this infant, we have to perform surgery to drain out the abscess because there is poor response to intravenous antibiotics. Clearly, this presents a danger to the patient. Besides the image-guided navigation system, we also require the expert management of our anesthetists and also ophthalmologists to deal with such a challenging case. And in this case, in this infant, we perform an endoscopic drainage of the orbital abscess. The challenge in such a patient is because of the unfamiliar territory. We know that anatomy of the a small child is not like the normal adult anatomy, and we cannot consider a small child anatomy as like a mini adults. And what more is that all those endoscopic sinus surgery instrument is usually made for adults, and we don't have any ready-made instrument for such a small patients, and thus we have to make use of the otological micro instrument. We have to improvise in using such an instrument to help us to do such a procedure. Following surgery, the child or the infant responded very well. There was no more fever in 2 weeks post-operative periods. The child was feeding well. The repeat CT scan showed there was no more formation of an abscess. There was no proptosis of the right orbital cavity. We have published our experience in dealing with such a challenging case to have others to manage their patient as well. Nowadays, rhinologists need to know how to perform a more complex endoscopic procedure, such as an endoscopic orbital decompression, because whenever patient has an orbital abscess, especially when they are immunocompromised, this is one of the best ways for us to deal with such a case, especially when they have respond poorly to intravenous antibiotics. Rhinologists have plays key role in dealing with emerging threats such as from a coronavirus infection or COVID-19 by recognizing certain presentation of that infection, such as the initial loss of smell and the loss of taste. And by recognizing such a presentation, rhinologists contributes to the early diagnosis of such a critical infection. To summarize my presentation today, I would like to highlight that rhinologists plays a key role in managing sinusoidal conditions. Rhinologists will always be relevant by using or utilizing the current advances in pharmacotherapy and techniques in surgery to deal with their patients. And rhinologists must always equip with the relevant knowledge to deal with emerging threats and remain relevant and significant in managing their patient in this changing world. Ladies and gentlemen, thank you very much for your kind attention.
Thank you very much, Professor Baharudin, for your interesting and insightful oration. On behalf of the Rector of Universitas Airlangga, our Vice Rector for Internationalization, Digitalization, and Information, Dr. Muhammad Miftahul Surur, PhD Internist Consultant, will be giving a ceremonial formal speech. To Dr. Muhammad Miftahul Surur, please begin your speech.
Thank you very much to our Professor Dr. Baharudin Abdullah, the head of Sutomo General Hospital Surabaya, the Dean and Vice Dean of Faculty of Medicine Universitas Airlangga, the head of Otorhinolaryngology, Head and Neck Surgery Department, and all the professors of Otorhinolaryngology, the Head and Neck Surgery Department. Esteemed guests, respected college, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Good morning. I would like to bid a warm welcome to all the guests today and express my sincere gratitude to Professor Baharudin. On behalf of Universitas Airlangga, it is now my great pleasure to welcome Professor Baharudin as the Adjunct Professor of Universitas Airlangga. Professor Baharudin Abdullah is a respectable and well-known professor in Otorhinolaryngology, Head and Neck Surgery Department in Universitas, Malaysia. We also know that he had published and presented many scientific papers in both national and international level. He is a leading expert in functional endoscopic sinus surgery, and his work focuses on allergy, immunology, and rhinology. And I'm very proud that Professor Baharudin Abdullah also actively served in the international professional community as both speaker and presenter. Therefore, through this event, I hope we can improve the bilateral relationship between Indonesia and Malaysia. I'm expecting this partnership to be beneficial in exchanging scientific knowledge between our two universities. And finally, I would like to once again welcome to Professor Baharudin, to Faculty of Medicine Universitas Airlangga. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Doctor. We finally reached today's main event, the inauguration ceremony. Once again, please welcome the representative of Rector of Universitas Airlangga, our Vice Rector, Dr. Muhammad Miftahul Surur, PhD Internist Consultant, to hand the honorary award to Professor Dr. Baharudin Abdullah.
Yes, thank you very much. It is the time to give you the certificate and pledge, Professor Dr. Baharudin Abdullah. On behalf of Universitas Airlangga and in particular of the Faculty of Medicine, Universitas Airlangga. I handed the certificate and plaque as your acknowledgement as the adjunct professor of otorhinolaryngology, head and neck surgery, Department of Faculty of Medicine, Universitas Airlangga. Congratulations, Professor Dr. Baharudin Abdullah. Thank you.
Thank you very much. Before we finish today's event, I hope professors, doctors, and all participants may take part in a photo session. Please turn on your cameras. Thank you. Thank you very much. That brings us to the end of today's event. May our event today be beneficial to all of us. Thank you so much for your attention. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh, and a very good day.
Waalaikumsalam.
Yun pamit. Ya.
Ya, terima kasih, Prof.
Terima kasih. Terima kasih.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, Prof.
Dr. Miftah.
Dr. Miftah, thank you. Dr. Mutarum, Dr. Dwi Reno, Dr. Romdoni, thank you. And Prof. Baharudin, thank you once again. And we have still continuation with the program of the Adjunct that 2022 we will have guest lectures and also writing assistance on the upcoming year. So I need more your help to to join with us. Thank you.
It'll be my pleasure. Dr. Budi, thank you so much for the honor. I would like to really work with you all over there, and I really look forward for more to come. Thank you so much.
Yay. Kena. Yay.
Now it's free and easy session.
Oh, Dr. Mia, tipin.
Halo.
Halo, Dr. Mia. Ya.
Halo, terima kasih perhatiannya ke kita.
Aduh.
Nanti ketemu lagi ya. Bye-bye.
Bye.
Sampai ketemu. Terima kasih, Prof. Bahar.
Terima kasih. Assalamualaikum.